Diabetes is one of the leading causes of amputations among older adults. Poorly controlled blood sugar that occurs in diabetes can limit blood flow to the lower legs and toes. People with advanced diabetes may develop wounds or sores that do not heal and can eventually result in loss of a portion of the foot. This was the case with Lake County resident Thomas Grieve. He explained to us he credits the team of doctors at Tri-County Foot and Ankle for helping to stop the spread of infection due to his diabetic pressure ulcers. And when faced with a partial amputation of his foot, this patient says Dr. Daniel Wassel provided extensive information about the procedure and instructions for postoperative care so that he would have the best outcomes and be able to resume his active lifestyle.
Having diabetes, I was susceptible to pressure ulcers. If I did a lot of walking or if I stood for any long periods of time. And it caused me to have 2 amputations before this. I developed a bad infection on my right foot and it couldn't be controlled. And it all stemmed from a pressure ulcer that I had on my foot. It limited me because I couldn't put pressure on it. Like Dr. Wu had been taking care of me before then, but when this ulcer blew up and the gangrene set in, the forefoot had to come off. So I'm very glad that he had a doctor like Dr. Wassel there at Tri-County, because he's awesome. Dr. Wassel is very specific in what he does as far as aftercare and before, but he explained everything, what was going to be done, and assured me that I would have no problems if I followed his instructions, which I did to the letter. After the procedure, I had no pain. I felt good. I felt as if I still had my forefoot, and I was allowed to go home the day of the surgery. It's quite a shock to the body when you're used to being able to just get up and walk and do anything, but with the balance problem, it was difficult. So once that got under control, I still have times where my balance is a little off, but I do the exercises at home faithfully. And the last time I saw Dr. Wassel, everything was fine. I'm still a little limited due to the half a foot, a forefoot, but I'm still basically able to go to concerts and sporting events and what have you. I can still pretty much do the things I want to do. They'll ask me when I go to an appointment, what was your blood sugar today? And when's the last time you saw your doctor? So they keep close tabs on it. It's like a big family. You're not treated like a patient. They treat you with respect. They're all great.
You'll find information on the story and for Tri-County Foot and Ankle when you click the Finding Balance StoryLink icon online at yourhometownhealth.com.